Hi, welcome to the Worthy Physician Podcast. I am your host, Dr. Sapna Shah-Hawk, a board-certified internal medicine physician. On this episode, I sat down and talked with Dr. Lara Hochman, a family physician who was kind enough to share her experience with burnout, what she did to change the narrative, and how she is now invigorated and energized with her newfound passion. She also gives some tips and tricks to help physicians find their sweet spot. So thank you first off for your time this morning. And tell me what your name is, who you are, and what you do.
I'm Lara Hochman. I'm a family medicine physician, and I help doctors find physician-owned private practices where we can practice with autonomy and really enjoy practicing medicine again.
And how did you get into that?
So I, like many of us, I had burnout. I had lost hope in the future of medicine. I thought that the only way to really enjoy life was to not be a physician. And at one point I left medicine entirely, and this incredible job fell into my lap. And, there was a lot of decision about what to do because I had left medicine. I was finally out, but the seemingly perfect job came along. And so I decided to take the leap of faith, thinking if I hate it, I can leave. But it actually turned out to be amazing, and I loved it and loved going into work every day, came back re-energized, was more present with my kids than even when I wasn't out of medicine entirely. And that's when I realized that, it's the system that is making us so miserable. And because I was in that incredible practice, I helped doctors to join us because I loved it. Right. And then word kind of spread that I help doctors find practices where we can be happy. So then some friends started calling me and asking for help finding them physicians. And so it just kind of happened organically that I do that. And at some point I realized, if I can do this with more of my time and put more of my resources into it, I can really make a big difference as far as burnout and how much of a seat we have at the table when it comes to, everything, all these crazy metrics that we have to jump through and these hoops and negotiating with insurance companies, because if more of us are in private practice, more of us will be happier, but more of us will be able to have a voice when it comes to all of those things.
Absolutely. And that's an interesting concept, saying that everything's going up besides reimbursement.
Exactly.
So can you tell me a little bit about your story regarding burnout and how long did you leave medicine? What happened there?
Yeah, so I've been burned out twice. The first time I was burned out, I had 2 little kids at home. I was even working part-time. I was always looking for that balance that just didn't exist. And a big part of it was when I left, I was still charting, and there was that emotional, I could never really leave because when I was gone, I still had all these charts open and labs to get back to and patients to get back to. So I didn't leave with all my work done. And there's, it's a very rewarding career, but it's also very emotionally stressful because you care, I care about my patients tremendously. And if something is going on with one of them, it's very hard to let go of that. And there's all the crazy things in medicine that we have to do and the patients we have to see and the billing and all of that. And so when I left at that point, it was actually because a large hospital system bought the private practice. And I kind of saw that as my out in a way. I did consider going to work for the system, and I spoke with them about it and decided that I was going to go work for them very part-time, just as a way to keep in touch with my patients because I really love my patients. But when I spoke with them and read their contract, it was not, there were so many deal breakers in that contract and they wouldn't negotiate anything at all. So I left, and it was really only a few months until I found this other position. Coincidentally, I wasn't looking. A recruiter found me, and I kept an open mind about it and was like, sure, whatever. What have I got to lose?
Sure.
I might as well speak to someone. Not thinking I would actually take the job, but turns out it was my dream job, so I did. But it gave me a very interesting perspective. The other time that I was burnt out, I would say it was more moral injury than burnout. it was, I wasn't able to make some pretty big changes that needed to be made where I felt that patient safety was compromised. I didn't have the equipment I needed to make, to do my job. Um, I didn't enjoy, you know, it wasn't the same collegial atmosphere that I was in before. It was very much a matter of I didn't have the voice in a very, very large issue that needed change. And it was so big that, I was just absolutely miserable. I wasn't sleeping. I wasn't present with my kids or my family. Um, and so I left at that point again.
Well, I mean, number one, that's good on you to know your boundaries. And number two, that you found your dream job. And how long have you been in your current position?
So I've been working with, what I do now. I started it while I was at the other company. So I've been doing it a little over a year right now.
Mm-hmm.
And I still do some locum tenens. So I still actually really love that company. So I do cover for them and do a little bit of locum tenens locally when I can.
Okay. And so how far are you out of residency, if I may ask?
10 years.
Okay. And when did you first get burned out? Was it within the first 5, as statistics say?
Let's see. Yeah. Oh, yeah. 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 So my first year out, I did locums, which I absolutely loved. I love
Right.
locums.
Right.
And then I was at the next practice for about 4 years. I'd say I got burned out. Oh, yeah. Within the first year of being in that practice easily. And then I stayed for 4 years, 4 additional years.
In the same position.
Mm-hmm. Yeah.
Wow.
I didn't know I was burned out. My husband would say to me, he didn't use the word burnout. That wasn't really a thing back then, but he would say to me, you're unhappy, do this, you don't have to stay here. This place isn't, he'd bring up all these things and I'm like, I'm not unhappy. I'm totally fine.
Right. I mean, but that's the way that we as physicians are almost trained to answer. I'm fine. I'm just going to push through it. It's got to get better.
Exactly. Well, and there's a study. So my husband's a psychiatrist, so he has, a
Gotcha.
very interesting take on that. And
Yeah.
so there's a study that he showed me that said, it was about depression, I believe, and they split the people into 4 groups, and the groups were that the one group was depressed and they knew they were depressed. The other group was depressed and they didn't know they were depressed. They thought they were totally fine. And then, I forget what the other groups were. But the group that did the worst in the long term was the group that had no idea that they were depressed, because then they were resistant to doing anything about it. And I think so many of us fall into that category. And, when we're so I would say a lot of us are clinically depressed because of the situation that we're in. And, we don't realize that it's a system and an easy change that can be made, or maybe not an easy change, but, if there's a change that can be made, we can feel so much better.
Oh, for sure. And during those 4 years that you stayed in a position that you had identified that you weren't happy, how did you cope with that? 4 years is a long time.
I didn't cope well.
Right.
I tried. The practice itself was actually a pretty great practice, and they were relatively flexible with me, where I kept changing my schedule. I said, okay, what if I just work mornings? And then that didn't really help. So I was like, okay, what if I just work, 2.5 days a week? Or what if I just, tried coming up with all these different scenarios. I mean, I really was trying to change things, but my kid, no matter which schedule I was on, she was always the first one dropped off at daycare and the last one to be picked up. And I don't know, I don't think I dealt with it well. I didn't really take care of my self-care, and I didn't do a good job. I didn't know that I was depressed. I didn't know that I was burnt out. I didn't know. I just thought, well, it's baby blues, or it's just because I'm not sleeping. My baby wasn't sleeping. I was like, oh, it's because my baby's not sleeping. It's, all the excuses we make up when,
right.
It wasn't that.
Right, right. And so now where you are, looking back, and if there was somebody early in their career, man, woman, regardless of specialty, what insight would you give to them that you wish you would have known at that point in time?
I think had I known that other people were feeling what I was feeling, that would have been huge.
Mm-hmm.
Another thing that I tell a lot of the physicians I speak to who are looking at jobs, and a lot of them end up picking big hospital systems where I know from, my friends' experiences that these are not they're not going to go well. But, we pick them for lots of reasons. And what I tell these physicians is, and really all of them, is to set a timer on your calendar. So every 6 months to check in with yourself and
Yeah.
check in, how am I really feeling? And I don't mean like, oh, am I happy? Am I not happy? But am I present with my family? Am I present with my friends? Am I sleeping okay? How do I feel about work? Am I excited to get up in the morning? Do I feel dread when I wake up in the morning? Because if you don't set that timer and you don't have that reminder, that's when we get so caught up in our lives and, just trying to survive rather than noticing how we're feeling and how happy we are in our position.
100% agree. It's something that I think, I know it helped. It took me a long time to develop that. And so it's something that if somebody does not already have that as a skill, would definitely be in their best interest to develop it. And would you agree that it's part of self-care and not selfish? Kind of goes back to the mindfulness that we hear so much about, but it really takes time to, number one, practice, and number two, see the benefits.
Yeah. And I would say I didn't see it until I was in a position that I was happy. And that was so eye-opening that, oh my gosh, we can enjoy it and we can be excited to come to work every day. And so, having experienced it now,
Right.
now I know that I was feeling so miserable, but it's really hard if you don't know what that is. And self-care is so important. And, when I first heard about self-care, I thought, gosh, that's so silly. Like, oh my gosh, it's so crazy. But, even just a 30-minute walk every day is so huge, just to have that solitude.
Absolutely. I mean, it's difficult, I think, going from physician brain and then transitioning when you get home to, okay, I have to take off that cap and put on a different hat because we have multiple roles. And so it's hard to make that transition if we don't, number one, create that transition, but we have to be aware of it.
Exactly. Yeah.
Because I can't go rationalize with my 4-year-old like I could a 40-year-old theoretically.
Exactly.
But I mean, the responses are going to be very different. And the responses to family, older family members are going to be very different. So what about your current position, your dream job, makes you excited every day?
I love helping doctors find better places. So the practices that I work with, I vet them. I really get a good feeling that they're going to treat their doctors well. And oh my gosh, when I help someone find the right job, it's very rewarding. It's certainly extremely tough. I had no idea how hard this was going to be. But I get excited to help doctors get out of these abusive situations. And just a couple of days ago, I was helping a physician that I've been working with for months. She was deciding between one of the best practices I've ever worked with and ever found. I mean, there isn't even turnover in the medical assistants. It's such an amazing practice. And she was deciding between that and a large hospital system that I know for a fact is not going to treat her well because I know people that have worked there. And, since this is my job, I don't want to be so blatantly like, this is such a no-brainer. Like, there is absolutely no question here.
Right.
And she ended up choosing the private practice, thank goodness. Um, but it's a lot of like, hey, when people say things like, well, the hospital system will offer me stability. I'm like, well, will it really? Doctors are getting fired and replaced with nurse practitioners. That's not stable. Or they're getting their pay cut with COVID, or it's not stable. Like, and even if it is a stable job in air quotes, it's not, you may be miserable. So is it worth it? Is misery worth it if it's stable? I don't think so.
No. No, you have to be alive to enjoy that stability. And we know what happens when doctors are not happy.
We're not good at asking for help. So we take drastic measures.
Yes, we do. Yes, we do. I don't know if that's a type A personality characteristic. So what you had made an couple of interesting comments. Number one, that a hospital system is not going to treat their doctors well. And you did bring to light, number one, being replaced by nurse practitioners or other mid-levels. But, since you've been doing this for about a year, what kind of pings you and says this is an abusive relationship with the hospital and doctor, potentially, versus this is a good relationship?
Oh, that's a big question. There's a lot of things actually. So, the abusive relationships. So I get calls from doctors who are unhappy in their current situations. A lot of what I'm hearing is, I'm so burned out, I'm so miserable. I'm working 5 days a week, and I asked them to go down to 4, and they said no. So, that's so silly, because then they're going to lose their doctor in the first place. Or they're double, triple booked no matter what they keep saying, I can't do this, I can't sustain this. Or being required to do a lot of after hours work unpaid. A lot of it is just the lack of autonomy, where doctors are saying, I'm in unsafe working conditions, and then they get pushback from their hospitals. Or, they say something about an unsafe work condition, and then they get fired. Or, there's so much saying, I see someone dangerous, a person who's hurting patients, and then the person who, it's like don't shoot the messenger. Well, the messenger is getting shot here, where the hospital is protecting people who perhaps don't cost as much money to hire and are ordering more tests.
Right.
And then they'll get rid of the physician who is, putting the patient first and knows what they're doing. There's a lot, I don't think every hospital system is a big evil corporation. There's a lot that,
right.
really do a great job, really do a great job. But a lot of it is in how they treat their doctors and how they just don't listen. They're making each doctor, they're ordering so many tests for the hospital system, and yet they're not getting paid for it or anything. And doctors in hospital systems are typically paid better, but they're just not treated well. As far as, how to treat someone well, or, what's a good situation, it's a lot of unspoken things. So a lot of it is in, when you speak to someone, do you feel like, a lot of it is in how they make me feel like they care. When I ask the private practices that I work with, when I ask the physicians, what makes your practice special? What makes your practice something that someone would come and work for? I get such great answers. It's things like, in this practice that I just helped this doctor find, she said things like, because I love my office staff all loves each other. We take care of each other. And she could go on, this practice owner could go on for hours about how wonderful their staff is and how they all get along really well. And how, if there's an issue in the office, that the practice owner stayed late, to fix, I think, a broken toilet. Then they all stayed with her to help her out and to dry the floor. And she kept telling them, you can go home. It's okay. And they kept saying, no, we need to be here to help you. And she's like, go home. You have to be here at 8 a.m. And they stayed until 9 p.m., So a lot of it is the company culture. You can tell so much about company culture. I mean, she had stories about, my office staff noticed I didn't eat, so they brought me a sandwich at 2 p.m., just like such sweet things like that. So a lot of it is what you say, and a lot of, or how, what the practice owner says and what they don't say. But, a lot of it is just hearing how the doctors get autonomy, or, there's another practice that I'm working with right now, and they're looking for a physician who will work towards partnership. And, they say, we want that doctor to join our meetings as soon as they start. They don't need to wait the 2 years till they become partner. We want to hear what they have to say. We want their ideas. We want to hear, we've all been in practice 12 plus years. So we want someone who's a little younger who can, bring, or older, but someone who can bring fresh ideas.
Sure.
And, so it's a lot of just what they say about what they're looking for often is a big tip off of how they treat their people.
Now, one thing coming out, from residency or still early on in the career, one big thing that I think draws people, that it's easy to say, don't let this be the hook, but it's the bonus or the student loan payoff, because medical school is expensive. Do you ever see any of that when you are helping physicians search, where that might weigh into the decision? And what advice do you give them if you can?
Yeah, that's the absolute number one thing that I see. No question. I knew what was coming when you started talking.
Right.
Yeah, it's a big one. And I, honestly, I don't blame it. So I've seen it go a few ways, because I work with doctors who are just about to finish residency, and I work with doctors who've been out with residency, and I do a lot of networking. Probably, one of my favorite stories from a physician who's been out for a while. He has his own direct specialty care clinic where, it's an orthopedist who does home visits and doesn't take insurance, which is pretty cool and,
Yes.
not very common.
Right.
But when he left residency, so he doesn't have kids, and he chose to work his butt off to pay off his student loans and become financially independent, so that is not ever going to be a deciding factor for him. So he did go work for a hospital system. He worked crazy hours, made a lot of money, and then left and started his own thing. So in that case, that worked out well. But I do see a lot of doctors who are either choosing the hospitals that are promising higher salaries with RVUs, and sometimes they don't make those RVU goals. They're unrealistic. Sometimes they do, but then the doctors are unhappy because they have to reach it by seeing a patient every 10 minutes, which is, not that realistic in most specialties.
Right.
But yeah, I mean, and then the private practices that I work with, sometimes they'll show me their finances so that we can help come up with a salary that makes sense for them. And they try their absolute best to pay their doctors well. I mean, they care. They say, I want to do something that's fair for the doctor. And oftentimes, especially in the ones that take insurance, they can't meet what the hospitals are paying. And then that's a big barrier to finding physicians, because the doctors just want a higher salary. And I don't blame the doctors with all the loans that we have coming out of school and feeling like, you need to know your worth is, the quote that I hear a lot is know your worth. And that's true. I do think we should know our worth, but we also need to know the worth of the rest of our lives outside of medicine.
Right. And how have you balanced your life currently with family and locums and helping physicians find a practice?
It's definitely been an interesting journey. So, I had finally figured out balance with medicine.
Right.
And then when I started this, it just all went up in the air again, and I had none. So I am still learning that all over again. Because there's no end in entrepreneurship. So I would wake up in the morning before my kids would wake up. I'd work, I'd get them ready for school, I'd work, put them to bed, work. And, because it just never really ends. And,
Right.
I was noticing that I was getting into that burnout cycle again, which is my own doing. I am my own boss. I am a terrible boss for myself. So I really have been focusing, and I have to consciously remind myself not to work. I'm a physician. I'm extremely type A.
Right.
And so I have to schedule my non-work time. So my kid, yesterday said to me something about, wanting to go bike riding. So I was like, okay, I live in Texas. We got to go early in the morning. So it's summer here.
Right.
So this morning we got on our bikes and we went bike riding, and it was amazing. And had she not said to me that, I would have just done my day as normal. And so a lot of it is I'm not perfect by any means. I'm still figuring out my balance all over again in this journey, but a lot of it is scheduling it. So during the school year, I schedule my times that I go work out on my calendar. And it's a class with other people who I like being around. I work from home now, so I'm not around a lot of people. So
Right.
This one workout class is so important to me because it's social and I love it and I have fun and it's exercise. So I schedule that for 3 times a week during the summer. I don't know what I'm doing because my kids are home. So once again, I'm just relearning it all again. But I think a lot of it is just being aware and knowing how I'm feeling, like we were saying earlier.
Right.
So that when I get into the cycle, for me, it's pretty, obvious when I stop sleeping, when I can't fall asleep or I can't stay asleep. I need to change something. That's when I know, like, I'm burned out. I got to do something.
No, that's really good. That's really good advice. So you've understood your own telltale signs. That's really huge. That's really important.
Mm-hmm.
I hope
sometimes it takes longer than it should, but so long as I realize, and my husband reminds me, like, I think I made a YouTube video on burnout, or no, on boundaries. And that evening, he's like, you just made a video on boundaries and you have none. You work all day and all night. I'm like, you're right.
But again, it goes back to that, I'm going to say a type A personality. That is the type of personality that medicine draws, and we're high achievers. And it's very, very difficult. It's almost ingrained in us. And I think fostered, if it's not already ingrained, it's fostered through the medical system, the educational system and training system. You always have to be doing something. You always have to be productive. And sometimes not being productive is exactly that. It is productive because you get to reset.
Exactly. And then we're more productive when we have that downtime. Like
Right.
when we're actually working, we're more productive if we have taken that time to just do nothing.
Absolutely. I've really appreciated your time and insight. And what message would you like to leave the listener with?
The big message that I'd love to leave you with is check in with yourself. If you're wondering if the grass really is greener, it might be. Reach out to someone and find out what's out there. A lot of us, especially in academics or in the hospital systems, don't even have any idea what it's like in private practice, or, there's so many different things out there. There's direct primary care. There's doctors doing anything under the sun you can imagine. And, I'd love to leave you with, you're not stuck, and there's always something out there. Things always get better. Sometimes it's just a matter of speaking to someone or figuring out what needs to change, because things get better.
And if somebody wanted to reach out to you, how would they reach you?
So I'm most available on LinkedIn. My name on LinkedIn is Lara Hochman MD. You can message me on there, or I think you have to connect and then message. My website is www.happydayhealth.co, and there's a contact form on there. You can always contact me through there. And please don't hesitate to reach out. I'm always happy to chat with doctors if you're wondering if the grass is greener, if you just are curious what's out there, or, of course, if you're looking for something, I'd love to help you find something.
And your goal is to help doctors be happy again in medicine. Is that correct?
Yeah, exactly.
And that's awesome. Well, thank you so much for your time, and I've loved chatting with you. So
Yeah, thanks.
thank you so much. And
thank you for joining us today. Subscribe, tell a friend, follow us at www.theworthyphysician.com.
Start again the second time around, the second time.